house-to-house basis be a more feasible way of conducting vaccination. Why? Kasi you know where these people are that you vaccinated. I'll vaccinate Naluntos, I'll vaccinate barangay this. Covered na, that's covered already. That's a safe barangay already, that's moved on. Then what are we doing? Whoever comes in, and whoever comes in, it's a good thing that it's computerized. Going back to the contact tracing, never plan trace. Apparently, trace is for DOTR, stay safe is for DOH. Why? Why have two contact tracing apps which are not connected to each other? I'll write the chip. I'll go down at Robinsons. DOTR knows I'm somewhere there in Robinsons. But they don't know where I actually went. I could have went to Yellow Hub. I could have went to, let's say, what's near there? LTO. I could have went to
Okay, good afternoon. I'm sorry for the delay. The other batch was using the Zoom account. Okay, so please ask your classmates to join in so we could start.
Instructor Bea join. I don't know if it's not a picture.
LGU has to assess their needs. That would work also, especially for senior citizens or vaccinated senior citizens. The question is, how many of those senior citizens are actually mobile? How about the debilitated senior citizens? How about the senior citizens na sinasabi?
Doctor, we can start the lecture.
Okay, so just ask them to join in.
Yes, doctor, they are joining. Now we can start, doctor. There is sufficient students to join the class.
Okay. So, good afternoon. So we are focusing on community diagnosis and problem prioritization. I have asked you to watch the lecture prior, and this would just be for clarification. So we've had lectures on community organizing. So this would um, be use that previous lecture as a take-off point for this lecture that will focus not on community organizing but also on how we use it in public health, such as um, endeavors like community diagnosis. Okay. So we've had this definition prior. So this is empowerment. We help people solve problems for themselves, take actions for themselves, and that is the basic principle of community organizing. It's really hard to start, especially if I have to admit. So I think I'd like to wait a bit more so that we will have the lecture straight. So please tell them to join in. It interrupts the lecture. Okay? So we have three O's. Of course, you have the organizer, the person doing the organizing, and the organization. So in English, this is from the people for the people. And this is the definition of empowerment. So we help people gain control over their own lives. So in community diagnosis, if we use the principles of community organizing, it is basically social investigation. So this social investigation is a method of investigation that consists of the preliminary gathering of data and information prior to launching and organizing effort in a community. Same way that before you initiate any treatment in your patient, you do investigate and you do your physical and history and physical examination to make your diagnosis. Same way with community diagnosis, you look at the history, do a physical exam on a community, do your social investigation such that you know what problems ails that community. Okay. So if you are organized, you could do big things. So small fish organized together could topple a big fish. And this is one of the reasons why we organize. So what do we organize? We usually organize a community. So these are a cluster of people with one characteristic, with one goal, with one interest. Okay? So it has 8 subsystems. So it has the community core. So these are the 8 subsystems. So you have your physical, education, safety and transportation, politics and government, health and social services, communication, economics, and recreation. So it refers to your diagnosis, refers to identification and quantification of your health problems in a community as a whole in terms of mortality and morbidity rates and ratios. So these are your social determinants of health. And then we identify and correlate this for the purpose of redefining those at risk, or those who are in need of healthcare. Okay? So it has different missions. So how do we diagnose the community? So we do your social investigation in community diagnosis. It's called community analysis. So this is the process of examining data to define needs, strengths, barriers, opportunities, readiness, and resources. So the product of this community analysis is the community profile. Okay. So what is helpful and may be done by looking at the following? You look at the demographics of our community. You look at the environment. You look at your socio-economic factors, health resources, services. You look at the health policies and study of target groups. Okay? So the following slides will be the different health indicators. So these are indicators of health, variables used to assess. So characteristics of these indicators, it should be valid, it should be reliable, it should be sensitive, it should be specific, definitions of which you have learned way back in first year, it should be feasible, and it should be relevant. Okay, so these are the different health indicators and how they're classified. Mortality indicators, morbidity indicators, disability rates, nutritional status, healthcare. So how you describe the community in its whole could be used as different health indicators. So we will not tackle them one by one. You have had this pre-recorded. You know the definitions of your health indicators. Okay? Morbidity rates, you have your disability rates, nutritional indicators, healthcare delivery indicators, utilization indicators, social and mental health indicators, environment indicators, socio-economic indicators, health policy indicators, and other indicators. So this taken in a whole, taken together, you would be able to see how a community could cope or could address certain problems. For example, in India, so what are the indicators that you are responding to the coronavirus properly? So for example, vaccination, you're able to produce vaccinations for your country. However, what India did, they exported the vaccines to other countries. Because of this export, there was suddenly a surge in your coronavirus cases. Your country ended up short with vaccines. Thereby, they had to stop exporting and give priority to your for the vaccines that you produce. So you could look at the health system. What happened there? It's short of it's lack of anticipation on one end, etc., etc. Health policies may have been in place. For example, an agreement may have been made for you to do the vaccine, but for certain compensation, such that you have to agree to export this to a certain country, etc. So there are a lot of factors that will be put into play. Hence, of course, we arrive at problem prioritization. In short, why do we need to prioritize? We need to prioritize because there's limited resources, limited um, manpower to solve or address problems. Hence, we pick problems that we have to address first. So prior to prioritization, we have to do proper community assessment, have agency self-assessment, have clear objectives and processes, and an established criteria. Okay, so these are the commonly used prioritization criteria. Of course, we look at cost or return of investment, if your solutions are feasible, how would it impact a problem, if the resources are available, how urgent is solving the problem, and the size of the problem. Okay? Okay, so these are interventions. So, is there someone available? Is an expert available to provide solutions?
Right. So with that, thank you very much. I for this afternoon. Thank you very much.
Is the solution effective? Is it easy to implement, etc.? Those are things that you have to consider. Okay, so central to this lecture would be the 5 prioritization methods. So you should know this. Fairly simple is your multi-voting technique. It just lists the um, criteria and then you vote off one by one what you would prefer. Strategy guide, we will look at it. So it would look at the feasibility and need of certain interventions. Nominal group technique, we discuss it and then we narrow it down. And the Hanlon and prioritization matrix, we assign a weight like an average to the size of the problem so that we could calculate which is more urgent. Okay. So this is like just voting for a class president. You have a list of problems, then you choose one or you choose few until you get one answer. Okay. So your strategy grid is like this. So you list it according to low need, high feasibility, low need, low feasibility, high need, high feasibility, and high need, low feasibility. So depending on your intervention and the needs of the community, you would be able to answer if you are able to construct your strategy grid. So your nominal group technique, so you first establish and then you brainstorm. So you generate list and then you simplify and clarify and you discuss the list such that you are able to rank the emerging nominees or categories as in order of importance and therefore be able to come up with a list. So your Hanlon method, so this is a complex method, is advantageous when the desired outcome is an objective list of priorities based on data and numerical values. It's because we use a certain criteria. So for example, this one has a rating, then it would be measured against the size of a health problem, the seriousness of a health problem, and effectiveness of intervention, and then you grade as such. So if it has a high grade, then it is would be on the higher list and would could and should be given more priority. So it uses the Pearl test. So is the intervention propriety? Does it follow propriety? Economics, is it acceptable? Do we have resources? And does it follow legality? So this is how we calculate your priority scores. So you look at the factors: A, size of health problem ranking; B, seriousness. So we put a weight of 2 because we deem it as more important. And if your intervention is effective. So we put more weight on the seriousness of the health problem such that we have a multiplier of 2 for your B factor. Okay. So your prioritization matrix is the most commonly used tool for prioritization. This is ideal when health problems are considered against a large number of criteria. So you create a matrix and you rate against a specified criteria. So you put 3, 2, or 1, met well, criteria met, or not met. So for example, you have your criteria like, for example, effectiveness of intervention, criteria 2, seriousness of health problem, etc. And then you also assign your factors and then you get your priority score. Okay. So there. So at the end, I would like you to have an activity by group. This is also an assignment. You will submit it also with your SWOT analysis. I'm giving you a day for you to complete this. So you do a strategy grid on your coronavirus pandemic. You suggest interventions and you look at if it is low need, high visibility, high need, high visibility, high need, low visibility, and low need, low visibility. At least 2 examples per box. Okay, so I will um, leave you to choose your groupings, or if there's existing groupings already for PMCH, you're free to use that. All right. Also, I would also assign you with your last requirement for your PMCH3, and that is to make a public health video. So this is a 5 to 8 video. Um, you could choose any topic that you wish regarding public health and spread correct information. Target audience would be your lay people. So your target audience would not be medical students. It will not be your professors. It would be people that you could come across along the street, your street vendors, your neighbors, etc., etc. So you may choose any topic that you wish. You make a 5 to 8 video um, so that you could raise awareness. Remember, in community organizing, the most important thing is to raise awareness, raise their consciousness such that they move and be aware of their own actions. Okay? But please give me a variety of topics. So if one make a list, if one is already doing a public video on, for example, coronavirus, please choose another topic. Okay, so this would be equivalent to one long exam. This is aside from your finals and one last long exam, this would be one of your final requirements for PMCH3. Any questions?
No,
Yes, Shiva.
Doctor, Doctor, what is the deadline for the strategy grid on coronavirus?
Strategy grid, I will give you 1 week.
Okay, doctor. And for the
The
uh,
SWOT analysis is open till tomorrow, 3 p.m.
Okay. And doctor, for the group video
Doctor,
that
So I'm giving you till final. So that is around 3 weeks, I think. So we
okay,
will
doctor.
view it after 2 weeks. Is the time enough for you? Fair enough?
Yes, doctor.
Okay.
uh,
Okay.
Doctor, in this new activity at the end of the slide, you gave a assignment for us. We need to do that assignment, Doctor.
Again.
Doctor, in this new activity, at the end of the slide, you provided us a assignment. We need to do that assignment, Doctor.
What? The SWOT?
Um,
The coronavirus pandemic. Do the strategy grid. 1. Second is your SWOT analysis. 2. Due tomorrow. And the last would be the video due after 2 weeks.
yes, Doctor. But in this new assignment, in the SWOT analysis, you gave us a assignment, Doctor, to make a SWOT analysis if you in the background of your experience in JFSM online
Yes.
learning.
Yes, that's the one due tomorrow.
Okay, Doctor.
Okay. Just a few, I just want to look at your strengths, weaknesses, opportunities, strengths in this online learning and how you see it. Okay? Are there any
Okay,
questions?
Doctor. No, Doctor. No more questions.
None, you may leave this call. Thank you. See you next week.
Okay, Doctor.
We have no I think we just have 1 or 2 lectures left.
Yes,
Um,
Doctor.
more on the public health video. That's why I'm assigning it already. So we will just polish it. So we're nearing the finish line. So keep up the good work. See you next week. Okay, you may
Excuse
leave.
me, doctor.
Yes.
Doctor, I sent you a message. Our long exam 3, I had a problem with my uh, connectivity and I didn't give the exam. I couldn't. I texted you on Teams app also.
I will look at it.